So as dermatologists, we talk about the ABCDEs of melanoma. A being asymmetry, B being border, C color, D diameter, and E evolving, meaning a mole that's changing over time. And change is one of the biggest things that we look for when looking for suspicious lesions or lesions that could be melanoma, especially something that's bleeding, hurting, persistently itching. In a mole that's already been there, those can be signs that it needs to come off. Or a melanoma can be something that comes up out of the blue on normal skin. So if you have a new place that's occurred within the past couple months, and especially if it's rapidly growing, that's something that needs to be checked. Generally, ideally, people should see a dermatologist for probably the most accurate assessment of some of these lesions. If there's high concern for it, or they're worried that they have a melanoma, then ideally you want to be seen within a couple weeks. You don't want to wait around with something like that. If it's something that's been checked before and they're just getting it checked again, then generally a several week to a month waiting period is not a bad thing. But if you're really concerned, generally within 2 weeks. Most people, if we're concerned it's a melanoma, we're going to do something about it right then and there, in terms of taking the biopsy at least to confirm that's what it is. The biopsies can vary, where we just take a small shave of the lesion if it is something that can be taken off that way, versus removing the whole lesion with a little bit more involved process. And generally those people, if we can't do it that same day, which almost always is something we do, we'll have them come back within a few days to a week's time to get it taken off. So in terms of an emergency, yes, we respond to some things a little bit more quickly than others, but generally we don't like to let people leave if we're worried they have a melanoma. If you are diagnosed with a melanoma, there are some variables that play into what kind of treatment is necessary. So thinner melanomas are generally treated with a simple excision, and the margins that we take around the lesion itself are somewhat dependent on the thickness of the lesion too. So like I said, thinner lesions we treat with a simple excision that can usually be done just in the dermatologist's office. Thicker lesions or larger lesions, those are the ones that we send usually to a surgeon, surgical oncologist, for a larger removal, and maybe lymph node sampling to see if it's spread. If there is evidence that it's metastasized elsewhere, which can be picked up with CAT scans, PET scans, things like that, then usually they end up in the care of an oncologist for chemotherapy or something along those lines.